So before we were thinking that pain, and even pain was called the fifth vital sign, right? And we thought that pain was probably one of the most important things to control. But in fact, pain is just a consequence of not controlling well the surgical stress and the autonomous nervous system reaction. And if you control your autonomous nervous system of your patient, so you are able to avoid that stress, then the outcomes of your patients will be really good and will improve. So these three parts of the message, very important, which is measure the autonomous nervous system in order to take control of the stress, which can be surgical stress or physiological stress or whatever, psychological stress even. And if you do so, then you will improve your health and your outcomes. And this is going to go all through the lecture today. So, which is the burning platform? Well, the burning platform is what I already said, is stress. Surgical stress, physical stress, psychological stress is our main enemy. It's our energy consumer. Is what we need to really control or to take under control. Because life is about energy. Life, in order to exist, has to have this energy. He has to capture the energy and he has to use it in order to defend itself from the different threats that it's going to find. This is the reason why there is a system that is called autonomous nervous system that is the one that is managing this energy and is saying that they will invest this amount of energy in order to grow yourself, or you need to invest that amount of energy in order to defend yourself. This is the sympathetic branch, the one that will defend you, and then you have the parasympathetic one, the one that will expand you, will make you grow, will make you happy if you want. We have a part which is anabolism, and we have another part which is catabolism. The catabolism part is the sympathetic part, is the one that is gonna use the energy in order to defend you. And the parasympathetic part is the one that is gonna use the energy in order to expand you and to make you grow. And this is the balance that we have to maintain. This is why I put here the yin and the yang. We need to keep this balance between the sympathetic and the parasympathetic. This balance is called homeostasis or allostasis. Homeostasis means balance in a fixed picture, and allostasis means balance through the time. So it means that we will need to be in an activation process sometimes. For instance, if we see a lion just behind me, I need to be on the sympathetic side. And if I am all the time on that setting, then I will get ill. For the first time, it was useful because I escaped from the lion with the sympathetic part. But if my system is all the time on the sympathetic side, I will become ill. And then you have as well the parasympathetic side. The parasympathetic side is the one that will make you rest and digest. It's very important to have rest after that run that I have trying to escape from the lion, but I cannot be on that side all the time because, for instance, if that happens, if the lion appears, I'm on the parasympathetic side, then for sure I will die. So this is exactly the same thing that fighting against bacteria, for instance. It's the sympathetic and the parasympathetic system, the one that will balance the inflammation process in order to defend myself from those bacteria. If I'm all the time infected, I'm all the time on the sympathetic side, then I will get a sepsis and I will die. And if I don't have that activation, when I get infected, then I will die as well because of sepsis. So it's all about the balance all the time. And this balance is called homeostasis if I just see it on a fixed picture, or allostasis if I see that through the time. And this is what I was explaining you. This is what is happening in your body. If I have an stressor, any stressor, it can be surgery, obviously. The knife of the surgeon is going to cut myself. That it's a big stress. or if it's I'm running on the street and I fall myself and I break my leg, or it could be just a psychological stressor, like I'm thinking that I'm going to die for whatever reason, or I'm thinking I'm going to be fired, or do you remember those peoples in Wall Street that were dying because of cardiac arrest? They were under a lot of pressure. That pressure was a stressor. So that stressor is going to provoke an activation of the autonomous nervous system, especially activating the sympathetic part. There is a lot of adrenaline and cortisol and hormones that are going to activate my metabolic activity in order to defend myself. And that is going to activate as well my soldiers, my white cells, and those white cells will release as well interleukins, which is a word that probably you may not have known, but this is just some substances that those white cells are spreading all over the body in order to kill the possible cells that can be harmful for myself, like bacteria, etc. Um, so that is what will provoke the inflammation. And that inflammation, like in the war, will attack obviously the enemies, but will provoke as well collateral damage. So my organs, if that is a very prolonged inflammation, my organs that are keeping me alive will suffer from that attack and can provoke what is called multi-organic failure. And then at the end, I can die. So people can die of psychological stress or can die just because of a big physical stress, a burn, a cut, a broken, whatever. Okay? This is a process that is called SIRS, systemic inflammatory reaction. But thanks God, we have as well another system, which is called parasympathetic. The parasympathetic is going to make completely the other way thing. So it's going to provoke anti-inflammation and relaxation and well-being. So when there is the activation of the sympathetic, immediately I will have as well the activation of the parasympathetic in order to maintain that balance that we were talking about, right? What is called the homeostasis or allostasis. And if I am fine and my body is healthy and my autonomous nervous system is powerful, he will be able to activate the sympathetic in the way that it has to be done and the parasympathetic in order to not compromise my body and defend myself and protect myself. Okay? But if it's not, then I will not be able to react on the sympathetic side or I will not be able to react on the parasympathetic side. If I am reacting too much on the parasympathetic side, I may provoke a CARS, a compensatory anti-inflammatory response syndrome, that will lead to a too much anti-inflammation, so no defense of my body, and I can have then infection because my white cells will not respond, and that infection can end up into sepsis, which is an infection all over the body, which will provoke a multi-organic failure and death with the same result than before. So you see that what we have to maintain is a balance between the two systems, and that is maintained if I have a healthy autonomous nervous system. So as you may see now, stress is the burning platform, is the devil that I presented to you before, because stress can provoke all this. These all are studies that are telling you that stress and inflammation is linked to postoperative pain, for instance. There are some studies as well that are talking that fibromyalgia is provoked as well because of this big inflammation or this big stress. Um, Stress is related as well to cancer. Catecholaminergic, as you can see, catecholamines can provoke the growth of cancer, of tumors. As well, interleukin 6, which is one of the inflammation factors, is directly related as well to neurocognitive disorders. So, Alzheimer or all these problems that elderly people and frail people may have may be related to these issues. Stress is directly related to mortality as well. People who go under surgery are not well treated, that surgical stress, that inflammation part of the sympathetic system have more chances to die than those that have been treated well. So it is very important. And as you see, the autonomous nervous system is the one that is managing this stress. So it is very important to measure what is happening with that autonomous nervous system in order to help him to go in the right direction that it has to go. And this is something that we already know. It's been the portrait of magazines like National Geographic or Times. Stress and inflammation are the silent killer, are the ones that are killing the people. This is what I was telling you before. The brokers in Wall Street were dying because cardiac attack due to this continuous stress, chronic stress that they were having that was provoking inflammation and attacking the veins and the muscle of the heart. So what we have to do, obviously, is to measure the autonomous nervous system in order to know where are we. We know, obviously, we have seen that the stress is very harmful, and it's very harmful because it's provoking this inflammation. This general inflammation can attack the different organs and can provoke these damages and these problems. Everything is fine until now. In any case, I will lead a question time that we can answer later on. Okay? So we go to the second part. So the second part of our story, I already make like a preliminary thing, which is the burning platform. What is happening in reality? I mean, during anesthesia, pain doesn't exist. What exists is the surgical stress and the changes in the autonomous nervous system, what is called this surgical stress, is what is damaging the patient. Pain only exists, and we will see that later on, if the patient is awake. We can only perceive pain when we are awake. Who here has gone to sleep with a toothache, and when he gets asleep, suddenly the pain disappears? I understand, and it's very clear that it's very difficult to go to sleep when you have a toothache. But if you get asleep, then pain disappear. It doesn't mean that what it was provoking the pain disappear as well. What means is that your cortex is asleep, so you cannot perceive pain. But as well, obviously, there is all those processes in your body that are still going on, which is not pain. It's surgical stress, we can say, or physiological stress in this case. So this is the reason why we have to measure the autonomous nervous system. And I would say that the best way to assess the autonomous nervous system is the heart rate variability. And this is something that was already said by a document of consensus of the cardiologist, US Association, and European Association, saying that heart rate variability, and I will explain you now what heart rate variability is the best way to assess the autonomous nervous system. And as we said before, the autonomous nervous system is the system that is managing your life. Obviously, heart rate variability should be the fifth vital sign and not pain.